According to a 2015 study by Princeton economists, death rates of white middle-aged adults in the United States, which is the largest population group in the US, have been rising after declining for decades. Now, I discussed this with you last year with 2015 data about this issue, and we have a new study published this month by the same economists looking at 2016 data, and they are using government health statistics, death certificates, and other economic indicators. And they have pointed out that mortality rates for white people are getting worse, all right? Death rates have been rising for adults 25 plus since the beginning of the 21st century. The death rates for non-Hispanic white people overall with a high school education or less are now equal to those of black people. Let's put up a graph here, and you'll see that this graph shows that among people aged 50 to 54, mortality among black people has been falling since the year 2000. Mortality among Hispanic people has been falling since the year 2000. Mortality among all white people has been slowly rising since the year 2000. And mortality among low education white people is rising drastically, especially over the last few years. In general, mortality rates among low education white adults have been going up since 1999. But check out the next graph where we're comparing American whites to other countries. You'll also notice some trends. If you look at other countries, mortality rates in the United States have been rising for white people aged 50 to 54 since the mid-1990s, whereas mortality rates for white people have been declining in France, Germany, UK, Canada, Australia, and Sweden. And in those other countries, mortality among white people is due to alcohol, drugs, suicide, and those have been declining also since 1990. In the US, you've seen a big increase in death due to what is called deaths of despair, right? Alcohol, drugs, and suicide. So what is impacting this? The study suggests that white people with low education had a sort of heyday in the 1970s where they had comparatively better jobs, they were relatively physically and mentally healthier, and that since then, the low education white cohort of Americans has become economically worse off and less healthy, which is understandably contributing to rising death rates. Note that death rates for college-educated white people continue to drop. You can't just attribute this to lower incomes because Black and Hispanic deaths have been declining over the same period, and those groups have comparatively lower income than do white people. So instead, the study points to what is called social dysfunction, declines in marriages, temporary relationships, children out of wedlock, social isolation. These are the hypotheses about the phenomena that are causing mental and physical health problems that can lead to substance abuse, that can lead to suicide. But there's something that's not mentioned here, which I think is really, really important. Wealth inequality, bad health care, a situation where access to health care and even hunger are problems in the United States. This is probably related to that angst that Trump supporters talk about, who said Trump is going to be the solution to my problems. The increased death rates of white people, I think, tell a big part of the story that we're seeing around Trump as well.
I can absolutely see that. And it's really too bad in a way, too, because if this was entirely due to health, you could say, all right, well, people should start exercising more or eat healthier. But it seems like a lot of the things that are contributing to this are things that people either can't control at all or have very little control on. Healthcare, what their income is. So it's a much more complex issue and one that's a lot harder to solve.
There is a homogenization that we are seeing because as we see some of the issues of white America blend into the issues that non-white America has been experiencing, higher mortality rates, lower incomes, etc. When you see low education white America starting to track more closely, I wonder, and this is not me relishing this is not a desire, it's merely a question, are we going to see a more unified economic populism demanded that is going to lead to left-wing populism being the answer, because we saw with Trump, this authoritarian, regressive right-wing populism resonated with many white Americans, not with non-white Americans. And I'm wondering what we will see over the next 5 to 15 years as a result of these numbers. And obviously the immediate should be, how can we start increasing longevity and decreasing death rates for all people in the United States?
And the thing is, when you poll people on the issues, they're by and large left-wing populists.
Yes.
So when you ask if universal health care is something that they would support, they say yes overwhelmingly. The same thing when it comes to taxing the top 1% and having a progressive tax system.
Right.
So they're in favor of these policies. It's just about getting the right candidate to market that. And I think that's what we had in Bernie Sanders, but unfortunately he came up short.
And a lot of it has to do with just the way you ask questions. If you ask if you poll all Americans or a representative sample of Americans and say, do you support government taking control of healthcare? People are generally not going to be that positive about that. If you say, does the government have a responsibility to ensure everyone has a basic level of healthcare regardless of ability to pay? It's a very similar question in reality, but it's worded very differently. Support goes way, way up. So we know that how vocabulary ties into your perception of your own politics has a big, big impact on whether you would support or oppose a particular policy.